right, so it's time for our beauty buzz. If you've been thinking about breast augmentation, but you're still on the fence of whether or not to see a plastic surgeon, we're going to give you a little more information this morning. We sat down with Dr. Christopher Park at Mobile Plastic and Reconstructive Surgery and Dermatology in Mobile to learn more about the surgical process. This morning we're sitting down with Dr. Christopher Park and we're talking about breast enhancement. Now explain exactly what that means.
Breast enhancement is a general term that I like to use to just talk about things we're going to do to improve the appearance of the breast. Now for different women that may mean different things. I mean it can range from breast augmentation, which is called breast implantation. That's basically using an implant to make the breast larger and more shapely than it was before. But breast enhancement also includes other surgeries that other women may need, such as just a lift or a reduction.
Okay, and today we're going to be talking about the augmentation.
Yes.
Now, who would be a candidate for augmentation?
Breast augmentation is for any woman who feels that her breasts are not as large or as shapely as she would like. A lot of women with some aging or after children, or after breastfeeding especially, or after significant weight loss, will get deflation of the breast. So even if there's still a decent amount of breast tissue, they may not have the shape that they want. Other women just never had as big or don't have as big a breast as they want, so we can do an implantation for that purpose. Now
before you come in, should you have an idea of how big you want to go?
Just in terms of cup size, which I don't actually speak in cup sizes as much. We actually pick different implants based on cc's. It's a much more medical process. But I need to know from the patient kind of what cup size they are, what cup size they're looking to go, and what kind of general feel they're looking for. Some women are wanting to look very natural, wanting just their significant other or very few people to notice, whereas other women want everybody walking down the street to notice.
Is there any way, besides the size, as big as you go, to make a breast enhancement look more natural?
Yes, a big difference is silicone versus saline implants, and there's a lot of things to talk about with silicone versus saline, but silicone implants are going to always look more natural.
Okay.
Part of the reason for that is saline implants are a little more firm. Also, they tend to ripple. If you kind of look at a saline implant, the rippling that can occur on the edge. So what we do to avoid that is we overfill implants a little bit beyond what you're supposed to fill implants to get rid of the ripple. But what that does is it makes the whole implant a little bit more round, a little bit more artificial looking. But again, some women want that appearance, and nothing's wrong with that. It's whichever the taste the woman is looking for.
And is there an advantage to choosing one over the other, choosing saline over silicone or silicone over saline?
There's pros and cons of each one, and I talk to each patient about them. I mean, in general, the advantages of silicone implants are that they're more natural, a little bit more shapely. They feel better. They do feel more like breast tissue. They actually have a lower leak rate. Because a saline implant has a valve on the back that we fill it through. So the shell has about a 0.5% risk a year of leaking, and the valve has about a 0.5% risk a year. The silicone implant doesn't have that valve, so you take away a 0.5% year of risk of leak. And that's just kind of manufacturer's error rate of something leaking. Some of the advantages of saline implants are you can adjust the size a little bit. You know, one size implant you can go up or down a little bit. So that's mainly on the table. That I may say I want to go a little bit bigger, a little bit smaller. You know, very rarely we actually going to go back and re-operate on a patient just to add some volume to the same implant, but it is possible. You can usually put saline implants through a smaller incision because you're putting it in empty and then you're filling it up.
And what about scarring on that same note?
Scarring, there's two types of scarring with breast augmentation. The incision you make and then the scarring or the capsule around the implant. We already talked about the capsule. Scarring with breast augmentation is very minimal. I mean, you could certainly, there's exceptions to the rule, but in most situations that's not an issue. There's 3 common incisions and 1 less common that I don't believe in. The common incisions are underneath the breast in the fold. The reason it's there is because that fold can hide the scar very well. Around the nipple, around the areola, where the dark skin becomes light, I can make an incision in there, and once that's healed, it's usually very hard to see because you're already changing skin color, and it just kind of hides. And then the third incision I'll use is going through the axilla or the armpit. Obviously avoids any scars on the breast. It does put a scar here. I mean, one of the downsides of that one is, you know, these scars only your significant other is going to see, or somebody you choose to let see, whereas the scar on your armpit, you know, when you're wearing a bikini or a bathing suit, anybody can see it. Now, they may not put it together that that's for your breast, but it is a scar that's visible more often. So my most common incision is actually around the areola.
So if you're thinking about breast augmentation, you can always come visit Dr. Park and get more information. You can read more about breast augmentation and get contact information for Dr. Park by clicking on the Studio 10 tab on fox10tv.com.